reason I
Yeah.
think that, I feel pretty comfortable giving it to patients that are fairly young, knowing that they have, if they had like decades and decades of side effects, I probably wouldn't do it. But given that this
Yeah.
medication has been around for so many decades and it's so good,
Yeah.
I feel comfortable giving it to even like young people.
So do I. Yeah, like seven. I've given it to 7-year-olds. Like that's the youngest I've ever given it to. But no, I totally agree. And people are surprised. They're like, is there no long-term study? Well, there is an ongoing long-term study because this is a
Right.
licensed drug in the FDA. So
Exactly.
it's a never-ending study because every time there's a problem related to isotretinoin, it should get flagged up to the FDA, and they keep a
Right.
log of it. So they're
Hmm.
able to look back. There was a big study looking at mental health related to
Hmm.
isotretinoin over the past 20 to 30, I think it's in the 90s, 20 to 30
Uh-huh.
years. And they used FDA data to show
Right.
that the incidence of mental health problems in isotretinoin patients was lower than that in the general population.
Right. And that's actually something to
Yeah,
just treat. Go ahead and treat,
yeah,
A lot of people are
yeah, yeah,
always
exactly.
scared or afraid about like that black box worrying about depression. And I always tell patients, even if you're depressed, isotretinoin will be good for you because it's going to help your self-esteem by clearing your skin.
Yeah, exactly. And I treated a lot of patients who are under like psychiatric care for
Yeah.
depression who have been referred to me by a psychiatrist to say, can you
Right.
please manage this patient because their acne is really destroying their life. And that's
Right.
partially why they're here.
Right.
So I think a lot of stuff, we know a lot about this drug. It's been around for a long time and it has had licensing and approvals in multiple countries all over the world. And it's
Right.
probably the most prescribed drug. I think it is the most prescribed drug in dermatology.
Yeah.
Yeah, definitely. So if
Mhm.
it caused all these long-term permanent side effects that everyone
It
reads
wasn't
about,
so
or
years ago.
we wouldn't be able to prescribe it anymore. Like
Right.
it would be taken off, because they tried to take hydroquinone off of our, make that illegal back in the early 2000s, and
Mhm.
that was then stopped because it was nonsense as well. But
Right.
yeah, so I mean, I think like Sarah at last is saying are just rumors. I mean, I think they're just rumors. I think one
Yeah.
person perhaps had something happen to them 10 years after taking isotretinoin and they say that it's due to the isotretinoin, but that's impossible to connect.
Mhm.
So
Yeah, and for
yeah, and I
as
like,
much
yeah,
39 as we prescribe worldwide, we would have heard of
yeah,
more of these like long-term effects, for
yeah,
as
like
long as it has been around.
exactly. And like you, I see a lot of patients on their second or third course of
Yes.
ISO. So, I did two consults, I did a bunch of consults through Zoom yesterday, but two of my patients have been on isotretinoin 10 years or 12 years, and they needed it again. And they were
Right.
totally fine. It's like,
Yeah.
they're healthy, well, otherwise, their acne was coming back, which is
Right.
normal when you get
Yeah.
older. Yeah.
Yep.
So,
That's great.
um,
That's great. What yeah, I agree with CH367. Trust your
just
doctor.
the
So
diet.
if
Yeah,
we want
thanks.
if we didn't want like the best of our of patients, we wouldn't be doing what we're doing.
Yeah,
So
I mean, and
I
also
think that
that's the thing. I think patients need to remember that, doctors are doing, I would never give someone a treatment for their skin that's going to hurt them systemically in the long
Mhm.
term. Like that would be totally unethical. Like for example, if I have a patient with a serious disease like ulcerative colitis or like rheumatoid arthritis, and they're having a side effect from their treatment that is causing a skin problem, I would generally not stop their rheumatoid arthritis treatment because
Right.
that's saving their joints or saving their bowel or whatever. So
Exactly.
even I prioritize systemic problems over skin. So the idea that we would prescribe something that would give long-term major problems to people to correct what many people see as a cosmetic problem, which is acne, that's totally insane. Like
Right.
I wouldn't be able to sleep at night. I would never do that. It's just insulting. And
Right.
you wouldn't do that either. So,
No,
we
and
do
I
what's
think
best
it's
for the patient.
it's clear that
Yeah.
acne, I mean, it affects a lot of people and it can be devastating, and it is not a cosmetic problem. It is a real problem.
What? Sorry, I was reading a comment. Sorry, Carla.
Oh, I was just
Um,
saying that like acne is a real problem. It's not a cosmetic
yes, of
problem. So
course.
like
It's not a
that's
cosmetic problem.
yeah.
Absolutely. Sorry. I mean to imply that, but some people think it is. So,
Yeah.
I don't think, I think it's a serious medical problem, but it's not, it's not cosmetic. But so thing is, people are saying, like there's a Facebook group with 10,000 people
Yeah.
about permanent damage, you know, and so I would say, so to a patient who's asking me questions like this, like I'm on a Facebook, you know, what's going on. I would say, I think you're not the right person for this drug. Like if this is the kind of thing that you look to information for, if this is what you believe, and no matter what I tell you, you're not going to be reassured if you're my patient, then I would.
It's not a great drug for you, like you're saying.
Yeah, it's not the treatment for you because you'll be freaked out. Like Alex is saying, I think it's just concerning because the exact mechanism is still so unknown. That's not true. We know how Accutane works. You know, we the exact mechanism is well understood.
And that's why we love it because we know how.
Yeah, that's part of the reason we love it, because it's the side effects are predictable. You can tell your patient exactly what to expect. We understand the dosing. Like I know how much I give and what that's going to cause in terms of dryness, and we understand the mechanism of action. It's a well-established drug. So, and so Sarah's saying, I'm just wondering why those Facebook groups exist in the first place.
I don't know. That's a good question.
I have no idea. Yeah, it's a great question. Ask the person who started the Facebook group.
Yeah, exactly. Ask the administrator. They may have an answer for you. Okay.